Welcome. We'll be presenting today Optimizing Oral Health in Older Adults, the relevance to disease and nutrition. I'm Melinda Luis, and I'll be presenting with Ujjwal Patel. This program is provided by the South Florida Geriatric Workforce Education Program in the Dr. Kiran C. Patel College of Osteopathic Medicine at Nova Southeastern University. My name is Melinda Luis, and I'm faculty with the Nutrition Program at Nova Southeastern University, and I'm the lead faculty on this presentation.
Hello everyone, my name is Ujjwal Patel. Professionally, I am a dentist from India, and I am also a Masters of Public Health student at Nova Southeastern University.
This presentation is provided through the NSU Geriatric Workforce Enhancement Program grant in the Dr. Kiran C. Patel College of Osteopathic Medicine, and our principal investigator in this grant is Dr. Nashira Pendia. Our learning objectives for today will be to describe the South Florida older adult populations who are at greatest risk for dental disease. We'll be identifying the causes of dental disease and nutrition-related consequences associated with 4 common systemic diseases in the older adult population, and also to recall evidence-based interventions to prevent and treat dental disease and nutrient intake problems in the older adult population, as well as recalling 3 community resources which will provide dental and nutrition service information to patients and healthcare professionals.
So, in this presentation, we are going to talk about the oral or the dental health in the geriatric population, its relevance to various systemic diseases like cardiovascular disease, diabetes, dementia, and immunocompromised conditions, along with its nutritional implication for each systemic disease. So, why oral health is important in older adults? Starting with the age-related changes, according to the US Library of Medicine, there are certain age-related changes like slower rate of cell regeneration, the tissue becomes thinner and less elastic, the hard tissue like bone becomes less dense and weak, and along with that, the immune system also becomes weaker. And that increases the chance of infection, and also the healing takes longer. And all of these changes also takes place into the oral cavity, which increases the chance of oral infection in later stages of life. Along with that, the older adults are also suffering from comorbidities like hypertension, arthritis, diabetes, and other systemic disease, and they take medications to treat those diseases. And these medications and the systemic disease have impact on oral cavity as well. Along with that, they have certain cognitive impairments that increases with their aging. And because of this cognitive impairment, there is decline into their judgment skills, process to complex information, and they have also difficulty to cooperate with the treatment and its measures. Also, they have some physical and sensory limitations which decreases their access to care, like keeping appointments with the physicians and dentist office, and it also becomes difficult for them to follow the complex information and instructions given by the healthcare providers.
Poor nutrient intake can result in malnutrition. So what is the cost? There are multiple costs associated with malnutrition in the older adult population. One being the financial cost, that there's a higher cost, up to about $42 billion a year are spent as a result of malnutrition in older adult populations, either institutionalized or acute care or in the community-based older adult population. We also know that patients who are malnourished tend to have a longer length of stay, up to twice the amount of time that someone who is well nourished would stay. Also, there's about a 54% higher likelihood that these patients will be readmitted after the 30 days compared to those who are well nourished. So the additional financial cost and burden is caused by longer length of stay, and also the challenges that that presents to the older patient as well as their families. And then the ultimate cost of increased mortality associated with malnutrition in this older adult population is anywhere between 1.5 to 5 times higher than that person who might be well nourished. And this data comes from the European Society for Enteroparental Nutrition. So why should we be concerned? Obviously, there are a lot of concerns associated with the cost, but what we do want to know is how can we help this older adult population? Well, understanding the causes of poor intake and its contribution to malnutrition is really the first place to start when we think about how to address these concerns and problems. So really the causes of inadequate intake tend to be complications of disease process. Diseases, medications also can be a problem as well because multiple medications can have side effects regarding taste, texture, food preferences. All of these might be impacted by medication side effects, and also ultimately the dental status of the older adult. If there's poor dental status, there are multiple reasons why that could contribute to poor intake and therefore an increased incidence in malnutrition. So as healthcare providers, what can we do to try to identify potential risks for malnutrition? Well, an oral screening, very brief and quickly in the primary care environment or even acute care or extended cares, just a very brief oral screening. Look at the oral mucosa, look at the dentition of your patients. It really only takes a couple extra minutes to do this. So that's a first line of defense in terms of identifying malnutrition. So we can definitely look at ways in which we can address the problem before it becomes a really severe issue.
So before we consider the correlation of oral health with systemic health, let's look at the population growth. The population growth in elderly population is contributing not only to the US but also to the Florida's median age. According to the data from the Florida Legislature Office of Economics and Demographic Research, the Florida's elderly population is increasing at a growth rate of 33% a year. And as a consequence, there will be a gain of around 60% in senior population until 2030. And also, the population number will be doubled of 2010 until 2040. If we narrow down the population growth perspective to the South Florida's population, according to the US Census Bureau's data, almost 16% of the population is elderly in Broward and Miami-Dade County. And also this population is growing according to the research of Zevallos that is done on Miami's elderly population, which shows that the elderly population of around 400,000 in 2015 will reach up to around 700,000 in 2040. This population growth has a huge impact on health. If we consider the various social determinants, according to the research by Gil Montoya, the older adults' oral health problems like missing teeth, dry mouth, and masticatory problems are correlated with their general health, income, and marital status. Also, the various culture and ethnic groups are also affected differently by the oral health problems. According to the data of National Institute of Dental and Craniofacial Research, African Americans and Hispanic older adults with lower income and less educations have not visited their dentist office in last 5 years. And also, if we consider the health insurance aspect, the Medicare services does not cover the cost for the dental treatment. And just to address this issue, in the fifth Oral Health Equity Summit that took place in last October, the stakeholders of the Florida, like various dentists, dental hygienists, and advocacy groups for the geriatric population, submitted an application to the Senator Pizzo to support mainly two things. First, a bipartisan administrative request to Center of Medicare Services, and second, to support the Senator Ben Cardin's bill S-22 to cover the oral health uh, coverages for the older population. So basically, the core issue was that if the Medicare and Medicare services can cover for the chronic health, they should cover the oral health treatments as well, which is correlated with the medical and systemic diseases of the geriatric population. Now let's consider the oral health and its relevance to the various systemic diseases and its prevalence into the South Florida's geriatric population. According to this infographics, the gum disease has impact on various systems of the body, like the musculoskeletal system in the form of osteoporosis, on the central nervous system in the form of stroke and Alzheimer's disease and dementia, even in the form of cancer, on the respiratory system in the form of COPD, and also on the heart disease. All of the oral manifestation of systemic disease are most commonly seen in the form of xerostomia, burning mouth, stomatitis, gingival and periodontal disease, which are basically the disease of the supporting structure of the tooth, dental caries, also known as dental decay, and various types of oral ulcers. Also, all these systemic diseases have their own impact on health in the form of physical immobility and mental disabilities, which kind of leads to the social isolation for this older adult population, and also leads to the poor quality of life for them. And the most terminal consequence is death. So now let's start with the core system of the body, cardiovascular system. The prevalence of cardiovascular disease in senior population in Broward and Miami-Dade County is around 10% and 23% respectively, which is from the Behavior Risk Factor Surveillance System data of 2016. The oral manifestation of cardiovascular disease can be seen in the form of sialidinosis, which is basically the enlargement of the salivary glands, gingival hyperplasia, enlargement of the gums, and lichenoid reaction, which is a type of a autoimmune disease called lichen planus. Here, the most important thing to notice is that all those conditions are caused by the drug the patient takes to treat the cardiovascular diseases. If we look at into the first picture, it is of gingival hyperplasia. The gums has increased in size, covering more than half of the tooth surface, which makes difficult for the patient to eat hard food, and also it makes difficult for the patient to maintain oral hygiene. And because of this bulge created into the gums, the food kind to be accumulate between gums and the teeth and increases the inflammation and bleeding tendency, which can be painful for patient. If we look at the second picture, it is of lichenoid reaction, which is caused by the drug known as angiotensin converting enzyme inhibitors. The lichenoid reaction in their initial stages are kind of not painful, but in later stages, due to the thinning of mucosa, it can be painful. So what are some dental considerations for cardiovascular disease? The first is the excessive bleeding. That can be a cause of excessive blood pressure, or maybe the medications like antiplatelet and anticoagulants drugs. The second consideration is the syncope, which can be a cause of high stress during the dental treatment, or maybe the excessive dose of the antihypertensive drugs, which can lead to the hypotension. Well, the last thing is the research which shows that there is a link between oral health and endocarditis. The research by Ito showed that the patients who are suffering from periodontitis predispose themselves tremendously to develop endocarditis in later stage. This can be seen increasingly in patients who have pacemakers or who have valve disease. The plausible explanation was that the oral infection caused bacteremia, and that can lead to the endocarditis, which is basically the inflammation of heart valves and walls. The another system is the endocrinal system, and in that system we are going to talk about the diabetes mellitus. The prevalence of diabetes mellitus in senior population of Broward and Miami-Dade County is around 26 and 25% respectively. The oral manifestation of diabetes can be seen in the form of gingivitis periodontitis, dental caries, and halitosis, which are the most common form. But the uncommon oral manifestation, which can be seen rarely and in uncontrolled diabetics, are the lichen planus and the neurosensory dysesthesia and the taste dysfunction. Here in this picture, you can see that the black color thing on the side surface of the tooth is the root caries, which is caused by the increased accumulation of the bacteria onto the tooth surface, which are attracted due to the high blood glucose levels. And this roughness caused by root caries causes increase in accumulation of plaque and calculus, which causes inflammation of the gum tissue, and the gum kind of recedes from its original position, exposing the root surface, which is known as the gingival recession. And the exposed root surface leads to the increased sensitivity during eating and drinking, which is often perceived by pain. And because of the loss of the supporting structure, the teeth kind of moves from its original position, which is known as the pathological migration. And you can see in this picture that the malpositioned tooth makes difficult for the patient to chew food, and it is also aesthetically unpleasant. Among various dental considerations, the first and foremost is the poor wound healing in the diabetic patients. This is because of the increased blood glucose levels. Also, the another consideration is the disruption of the immune system function. It is because of the higher oxidative stress that is caused by the increased metabolism of lipid instead of the blood glucose, which is caused by the insulin resistance or lack of insulin. Lastly, the research shows that the gum infections known as periodontitis make the status of the diabetes worse in the diabetic patients. It is because of the inflammation of the gum tissue, which causes the increase in the inflammatory mediators. And among these various inflammatory mediators, one of them, known as interleukin-6, targets the liver. Well, liver is the main organ for signaling for the insulin mechanism. And because liver is targeted, there is impairment in the insulin signaling mechanism, which leads to the decreased production of insulin from pancreas.
In addition to the dental concerns that we've discussed so far, there are nutritional concerns associated with chronic diseases such as diabetes and cardiovascular disease as well. So we often see multiple medications being taken with these disease process that can lead to problems such as dry mouth, impairment in smelling and taste is going to impact appetite and therefore overall nutrient intake. Also, concerns that we see are increased infection risk and poor wound healing. And when nutrient status is poor, these can be exacerbated. So what are some simple, really, interventions that we can do to address these concerns? Encouraging water throughout the day, even in small amounts as primary hydration source, can contribute both to rinsing the mouth throughout the day and decreasing the potential for dental caries because food and substances may remain on the teeth, but also it increases the hydration for this older adult population that tend to be at risk for dehydration. Also, looking at controlling blood sugar levels is definitely a focus in this population, and we often do that through a carbohydrate-controlled meal plan, and that is a meal plan that's established by the American Diabetes Association. And it is a carbohydrate control, not particularly a low carbohydrate intake. It just needs to have a meal plan that's designed to address the concerns of that individual. Also, monitoring the use of vitamin and herbal supplements is really an important thing to explore with older adult population because they do tend to consume a lot of individual vitamins and minerals and herbal supplements, and those can have blood thinning effects that can be difficult to deal with when there's dental work being done, and if excessive bleeding occurs, as mentioned before, can create additional problems. We also know that with Medicare Part B, there is support for nutrition counseling regarding the diets for diabetics, as well as renal disease, and we're increasing the potential for reimbursement in Medicare through additional legislation. Also, thinking about some of the concerns that we have with overall nutrient intake in this population, liberalizing the diet is oftentimes an important part of treatment with these, with an older adult who has multiple disease process, because if their intake is poor, we want to at least increase their intake and then really look at therapeutic diet restrictions later on when their nutrient status is more stable.
The third system we are going to look at is the central nervous system, and in that we are going to focus on dementia. Well, it is important to notice that dementia is not a single disease, but it can be seen with many other central nervous system diseases like Alzheimer's and others. It is caused by the damage into the brain cells, which decreases the judgment skills, complex information process skills, and cooperation skills for these dementia patients. The common or oral manifestation for the dementia patients are gingival inflammation and bleeding, periodontal pockets, and high level of plaque, which ultimately leads to chronic periodontitis, which is inflammation of gums. In the pictures, you can see that the teeth surfaces are covered by the yellow-grayish plaque, and the gum tissue seems to be inflamed. Also in the X-ray, you can see that there are black lines in between the tooth, which is caused by the voids because of the degradation of the bone between the teeth, and there is no supporting bone structure between those teeth due to the chronic periodontitis infection. So there are certain dental considerations for these dementia patients. Starting with the short span of concentration, these patients cannot hold water for a long time during the dental procedure, nor they are used to open their mouth for an extended period of time during the dental procedure. So the dentist needs to keep their appointment for a short period of time and plan the comprehensive treatment in an incremental manner. Also, another important point to consider is that they are not able to process the complex informations given by the dentist. And it is because of the impairment into the cognitive skills. So it is always advantageous to give them simple and short sentenced instructions and also explain the procedure and the instructions to their caregivers. Also, another important thing to consider is that it will be an advantage to use the powered oral hygiene tools into these patients because they have less manual dexterity. And the powered oral hygiene tools can be powered toothbrushes or the water picks, which can contain a medicated water in them, which helps to reduce the chronic periodontitis. Lastly, there has been the research shows that there is a link between periodontitis and dementia. According to the recent research by Dwell in 2018, it shows that patients with periodontitis have 6% higher risk of developing dementia. Into the plausible mechanism, the researcher explained that it is because of the bacteria or the toxins that flows along the bloodstream to the brain, or maybe because of the inflammation which is triggered into the blood-brain barrier.
Along with the dental concerns that we've spoken about, there are nutritional concerns among these patients with dementia. Some of the problems that we might see are, of course, missing teeth, in which case that can impact their intake overall. But also, it's common for them to lose their dentures or throw them away on a regular basis. So they may have a problem maintaining their ability to consume foods adequately because of the fact that they have chewing problems or concerns. Also, with ill-fitting dentures, oftentimes, due to their cognitive impairment, they might not be able to communicate that their teeth, that their gums are hurting them or that there are problems chewing, and therefore they might refuse food, but are unable to tell you why they're refusing that food. And also, behavior concerns are very much a concern among this population. We oftentimes see refusal of intake of food or fluids. We can see combative behavior that can definitely impact their ability to receive assistance during meal times. And also, as a result of all this, they may be at a higher risk for aspiration and thus aspiration pneumonia. So we look at some of the guidelines for nutrition interventions, as mentioned with the ESPEN, or European Society for Parental Nutrition Guidelines. Some of these interventions might be, first of all, really to address behavioral problems. So looking at interventions, compensatory mechanisms to implement during the feeding or eating process is definitely an area that needs to be addressed. Also, making modifications in perhaps food consistencies or frequency of food intake can also be helpful in addressing these problems with the dementia patient. And again, oftentimes eating assistance is necessary from a caregiver or family member to either cue the individual to eat food or drink food up to the point of actually feeding the patient the food directly. So these are concerns or considerations that we want to make when assessing these patients for nutritional concerns.
So, the last system we are going to talk about is the immune system. And in that, we are going to talk about HIV and cancer as the immunocompromised conditions. The prevalence of HIV in Broward and Miami-Dade County is around 34 and 43 per 100,000 population respectively, and this data is from Florida Health Charts. The prevalence of cancer in senior population of Broward and Miami-Dade County is around 13 and 14% respectively. The oral manifestation of immunocompromised condition can be in the form of fungal infection, viral infection, and bacterial infection. The fungal infections are most commonly are seen in the form of candidiasis and angular cheilitis. The viral infections can be herpes simplex and herpes zoster infections. The bacterial infections can be tuberculosis and syphilis. All these infections manifestate in some kind of oral ulcers into the oral cavity, but these ulcers can be distinguished from each other according to their location and their size. For example, the ulcers from the herpes simplex can be seen on hard palate and gingiva, and they are of smaller size known as pinhead ulcers. While in the case of herpes zoster, the ulcers are only seen on the half of the oral cavity, either right or either left, depending on which nerve dermatome of the oral nerve is affected. And the last oral manifestation is aphthous ulcer, which is caused by the stress or the treatment of immunocompromised condition. In the first picture on your left, you see the white patch on the lateral surface of the tongue, which is known as oral candidiasis. It is kind of non-painful and can be removed with the scraping of the tongue. But below that white patch is the red inflamed tissue of the tongue, which creates a burning and painful condition for the patient while eating, drinking, and even speaking. On your right, you see the white patches into the inner surface of the lip, which is the oral aphthous ulcer in their initial stages, and they are surrounded by the red halo, which shows the inflammation of the oral cavity, and it makes it difficult for the patient to eat and drink and further deprived from their nutritional requirements. The dental considerations for these immunocompromised conditions are mainly related to their treatments. Starting with HIV, one significant consideration is the transmission of the infection. The patient should be educated not to share their oral hygiene aids like toothbrush, power toothbrush, floss handles, and water picks to prevent the spread of HIV infection to their family members and to their loved ones. Um, According to the research by Bonito, it shows that patients who have been diagnosed positively by HIV has increased rate of post-extraction complications, and these complications can be increased bleeding, persistent pain, localized alveolitis, also known as dry socket, local wound infection, and delayed wound healing. In case of cancer, the main dental consideration is related to radiation and chemotherapy, which kind of increases the blood flow to the tissue and impairs the healing capacity after the surgical dental procedure. And it leads to the infection known as osteoderonecrosis of jaw, which needs to be treated adequately.
There are nutritional implications associated with immune-compromised patients and overall nutrient intake as well as nutrient status. So really looking at screening the individual for malnutrition, what are some signs and symptoms that the individual may be malnourished through biochemical assessment as well as physical assessment. And there are a variety of malnutrition screening tools that are available through the mini nutritional assessment or the determined checklist, which are tools that are used to screen an individual for potential for malnutrition and really increasing the awareness of the potential problems. Really using whole foods as a primary intervention for individuals as opposed to individual nutrient supplements such as individual vitamins or even liquid nutritional supplements. Offering whole foods first is always a better option. But also looking at increasing calories and protein in the meal plan is important to optimize the nutrients that the individual consumes. It's not uncommon for individuals with, say, with chronic diseases to have a preference for high calorie, high sugar foods. So addressing that in terms of meal planning is necessary as well. And consulting with a dietitian so that we can really look at the medical nutrition therapy and full nutrition assessment for the patient and really individualize their treatment plan. And we may want to consider an evaluation by a speech language pathologist to evaluate swallowing function and also to hopefully optimize nutrient intake.
Towards the conclusion of the presentation, we want to talk about few take-home messages from the presentation. To maintain optimal oral or dental health, the dentist should consider the systemic health and medications while treating their patients. They should also refer their patients to their physicians to treat the systemic diseases that can affect the oral health of their patients. Also, on physician part, the oral examination should be included into the routine history-taking procedures for the elderly population. And also they should work in collaboration with the dentist. Lastly, the elderly population should be educated along with their caregivers on their oral health status so that they can maintain the optimal level of their oral health. They should be also educated onto the relevance of oral health with the systemic disease.
Also with nutrition, really we should look at screening for malnutrition and how that can identify those at risk for potential dental problems and contributors to malnutrition. Also, don't forget to educate parents, patients, and caregivers and the family on risk factors of malnutrition by encouraging optimal nutrient intake. Also, make sure to consider referrals to dental professionals as well as dietitians, consider speech therapy and other health professionals that can address the nutrient concerns of the patient. We want to really support an interprofessional team approach. So some resources that can potentially assist with providing dental and nutrition treatment and interventions. From a professional perspective, might be the American Dental Association has a variety of resources as well as patient education materials. Through Florida Health, there are some dental and nutrition services that can be provided. And also through Florida's Health and in Broward County also provides nutrition services. And then from the consumer aspect, there's free dental care that's offered in Broward County. There are dentalclinics.org, which could provide free or low-cost dental care and screenings. Also, the Academy of Nutrition and Dietetics has a lot of patient and consumer information regarding nutrient intake, reduction of malnutrition, and also the National Institute of Dental and Craniofacial Research provides some additional education information for both patients and caregivers, as well as providing professional support. We'd like to thank you today for joining us as we spoke about optimizing oral health and nutritional status in the older adult population. As a part of our research project through Geriatric Workforce Enhancement Program at NSU, we ask you to take this evaluation. Just scan the QR code and respond to the questions provided. Or if you are not able to access the QR code, the URL is down here at the bottom. You can just enter that information and respond to the questions. And this particular topic is should be identified as a oral health topic or dental topic. Thank you for your attention.